In this audio lecture, we're going to be talking about immunodeficiency. Okay, this would be in the immune system disorders, and the specific disorder that we're going to talk about in this audio lecture is AIDS. Okay, so immunodeficiency is going to be a reduced immune response, so this could leave you susceptible towards other infections. Some common causes or etiologies of immunodeficiency can include other infections, so like viral infections. So we have some viruses, like we're going to be talking about today, the HIV or human immunodeficiency virus, that can result in pretty much a diminished immune response resulting in AIDS, acquired immunodeficiency. Okay. Other causes can be iatrogenic, right? So iatrogenic reactions are going to be drug-induced reactions, and that is not the intended effect. Okay. And so we oftentimes see that reduced immune response really increases susceptibility towards diseases, either simple infections or in the case of AIDS, we see that it can leave you more susceptible towards the development of cancer. Okay. So these diseases would normally be prevented, and then we see that bacteria and things like that can really become a problem because you don't have an immune system to counter them. And so we are susceptible towards opportunistic infections and immunodeficiency. Okay. This can be acute, meaning really short-term, or more long-term, being chronic. So this can be generally classified as two different things. It can be either primary or secondary. So primary is the result of a disorder itself, and then a secondary would be like something like leukemia or lymphoma that leaves you more susceptible secondarily to a disorder. And so we oftentimes see that you can have secondary disorders as a result of some other disease state. So AIDS, that is going to be our topic for immunodeficiency. And what causes AIDS? It is HIV, so the human immunodeficiency virus that is a retrovirus, meaning it uses our machinery to replicate itself. And so HIV infects CD4 cells, otherwise known as helper T cells, and macrophages to take over that machinery. And so we see that really HIV is indicated, and we monitor it by measuring our helper T cell count. And so as this virus takes over our body, okay, it reduces the amount of circulating CD4 cells, or helper T cells, and that leaves you immunocompromised. So we have two primary types of HIV. We have type 1 and type 2. Type 1 is the most common strain, and type 2 is more common in West Africa, and it progresses more slowly. And so we see that AIDS affects really anybody, right? But there are populations of individuals who are more susceptible. Okay, so AIDS impacts 35 million people worldwide, 1.2 million people in the US alone. Okay. Numbers are decreasing, and we're learning how to manage and treat the AIDS, but in the 80s, the AIDS epidemic was running rampant. Okay, and it was running rampant among certain populations, high-risk individuals. And so those high-risk individuals include African Americans, individuals in the South, and then men having sex with men. That is, so it happens. Transmission can occur anywhere though. So men having sex with women, women having sex with women. We see that this virus doesn't really care, but there are some high risk activities like sharing needles. Okay, and we see that drug users can acquire HIV and develop AIDS as a result of drug use via needles. So how is AIDS transmitted then? So AIDS is transmitted by body fluids and then blood. Okay, so it is living in there. It is taking over. So helper T cells are in our blood and our body fluids, and so anything that can transfer those body fluids can transfer the HIV. Um, Now, it's important to note that there are activities that do not transmit HIV, and so you shouldn't be concerned about this terribly much. Um, you should be concerned about maternal to newborn transfer or even pregnancy, sexual contact, and needles. Um, Now, it should be noted that saliva does have the HIV virus in it. It is not highly transferred in that mechanism. So you have this little picture over here in this, pull up my pointer. So you have this picture over here, and it says that HIV is not transferred via saliva, sweat, tears, or closed mouth kissing. Closed mouth kissing is definitely correct. Saliva is technically incorrect because it can be transferred via saliva if it is present in low concentrations, but if the individual that does not have HIV has an open mouth sore, it can result in virus transfer via that mouth sore. But it requires some sort of route of transmission to get in there. It needs to get into the body. And so the digestive system is technically considered outside of the body. Okay. How does HIV really affect the body, and how does AIDS develop? It is important that you aren't acquiring AIDS, but you are acquiring HIV, which leads to this immunodeficiency state. Um, so first off, we see HIV enter the body. So this is a helper T cell right here, and it binds to, or this is a helper T cell right here, and it binds an HIV virus, or the HIV. And so the HIV enters the helper T cell, and then it ends up using our own machinery, specifically it's using the polymerase um, um, to replicate itself. And so it builds and builds and builds inside the cell, right? And it is known as reverse transcriptase, where you're converting RNA into DNA, right? So here's where it integrates with our DNA, and then it becomes a part of our own genetic material, and it's using that machinery that we use to replicate things such as for protein synthesis. We're using the similar machinery inside of our own cell to incorporate the genetic information from the virus into our own DNA. Okay, so once you have it forever. You can only manage the symptoms. And it leads to this asymptomatic phase. So asymptomatic phase is not outwardly expressing any manifestations, but it is replicating inside of our body. All right, so AIDS progresses through 3 different phases: immunodeficiency, autoimmunity, and neurologic dysfunction. And so first of all, the immunodeficiency, right? So what is immunodeficiency? It is a dampening of our immune system, right? So if the HIV starts to take over our own helper T cells, this leads to a reduced immune response. Remember that helper T cells are critical in activating B cells, cytotoxic T cells, and so they don't act unless they have helper T cells. And so if you don't have the helper T cells acting, they don't have this co-activation that is required, and so you end up being immunodeficient because of that. Now, you could progress then to autoimmunity, and we already talked about autoimmunity in another lecture using lupus as our example. And so you could end up attacking your own cells So you can develop arthritis because of this. And then there's lymphoid interstitial pneumonitis. And then really the one of the final stages in this condition is neurological dysfunction. Okay, so you have AIDS dementia. We'll talk about that in the neural disorders. So how are the manifestations of AIDS? What are the manifestations of AIDS? Well, first of all, when you are first infected, it is known as the asymptomatic phase, and so this is right away. Um, and what you have is you have flu-like symptoms. Okay, so flu-like symptoms, so you just might feel a little sick. It can lead to um, lymphopathy, which is swelling and pain of the lymph nodes, fever, headache, malaise. Malaise is just general, just ill feeling. Um, and then as the virus increases in your body, as it progresses, you begin to develop other conditions like weight loss, right? So now your body is not acquiring the energy that it needs, or it's wasting it. Lymphopathy, which we already discussed, it's the swelling and tenderness of lymph nodes, diarrhea, fever, cough, shortness of breath. Those are all very non-descriptive manifestations. And so this is kind of an insidious virus because really you just think you're kind of sick. Okay, um, and it's much more severe than just sickness. Okay, so how do you diagnose AIDS? You diagnose AIDS by performing. Well, in the past, it was performed as an enzyme assay, which is a labor-intensive assay. An assay is just a test, and so um, it's a labor-intensive test that requires confirmation. Okay. But now we rely more heavily on rapid testing, so this can give us almost immediate results. If you look at this figure over here, this is an oral swab test that is a take-home test actually. And so they send home, they will send you this test in the mail, so you can take it in the privacy of your own home, okay, and not deal with any of the stigma that is associated with AIDS. And so for people who are being safe and practicing safe sex, it's important that you get routinely tested for AIDS or HIV, right? So it's important to know if you are infected with HIV, because otherwise you're just continuing to go out and spread it. So they've made it easier and more less pressure associated with the testing. Um, and so during the swab test, what you're doing is you're swabbing the upper and lower gums, okay, and it gives you a positive or negative. And so if you get two lines here, so this is the line here, and this indicates that the functional test is working. And then the T, if a line pops up there, that means you have antibodies for it, or that this test is indicating it. Now it's important to note, you just don't stop there. Okay, you go and get confirmation tests. So then you would go to a clinic, and you would get a blood test looking at looking for the antibodies. Okay, and then confirmation. Then we can then go forward with the treatment and management of this infection. Okay, so for the progression, we really want to monitor the viral load, and so look at the levels of the virus in our body. Okay, and so retroviral therapy can actually reduce the amount of virus by reducing the um, effectiveness of the replication. So it's important to note that really these positive tests can occur as little as 1 month after infection. Okay. It should be noted that in children, the appearances are different from adults. So children don't display the normal manifestations of HIV infection where you start to weight loss. You begin to lose weight as the disease progresses. But in children, you're going to experience difficulty gaining weight. So, weight is important in children, and so it moves up a line. Okay, so adults are maintaining weight generally or slightly increasing, very rarely decreasing. But children, if they have difficulty gaining weight, okay, they have difficulty growing, if they develop problems walking, okay, these are all indications of a HIV infection in children, and you wouldn't suspect this unless you know that they've had exposure of some sort. Okay. And so you can see delays in mental development, and then other routine infections, okay, like ear infections or pneumonia or tonsillitis. Okay. So you measure the progression through a polymerase chain reaction, the same test that is used to confirm coronavirus. Okay, so this progression is based on your helper T cell count, like I mentioned before. Okay, and then that's going to be one classification, and then you have manifestation presentation, right? So first of all, you have the helper T cell count, and that's going to be categorized as category 1, 2, or 3. Okay. It's category 1. You have if you're still healthy, okay, you're keeping the virus in check. You have more than 500 CD4 cells. Category 2, you're going to see reductions in the circulating amount of CD4 cells between 200 and 499. This is going to be cells per milliliter. And then category 3 is going to be the development of AIDS, right? When you have a CD4 count less than 200. So it's important to note that you don't get AIDS just because you have HIV. You need the helper T cell count to go down, and then you develop the immunodeficiency. Okay. All right, so diagnosing HIV along with the tests, okay, you look at the helper T cell count to help you diagnose this. Okay. There's category 1, 2, 3, and then what is the normal helper T cell count then? Right, so you need to put everything in the bigger picture. 500 to 1500 cells per milliliter or microliter. So this helper T cells, remember that the helper T cells are involved in activation of B cells, cytotoxic T cells, and releasing cytokines to attract neutrophils and basophils and everything else. So you really become, if you drop this level down too much, down below really 200, you develop this immunodeficiency state. All right, so now we're going to focus on the manifestations, and these manifestations would be indicative of HIV, of an AIDS infection. And so this is going to present, so we have 3 different categories. We have category A, B, and C. C is the worst manifestations. A is going to be a relatively early HIV infection or a well-managed HIV infection. Okay, so category A is going to be asymptomatic HIV infection. Okay, so this means that you are keeping the virus in check, or it hasn't had time to develop, progress too much. Okay, you have generalized lymph node enlargement. Okay, so this is lymphopathy right here, and then oftentimes you'll feel fatigued, so that you're tired. Okay. All right, so here we have category B, and this is when the manifestations start to progress and they get worse and worse and worse. And so you're developing immunodeficiency here, so your T cells are getting worse. And now it's important to note that the category using the numbers is based on the helper T cell count, and then the categorization based on the manifestations is based on, well, the other classification on the letters here is based on the manifestations present or the symptoms, right? So we develop develop some immune deficiency in which we're seeing opportunistic things take hold. So you could get uh, bacillary angiomatitis, which are skin infections, which is right here. You could end up developing yeast infections on mucous membranes, like your tongue. So this is an oropharyngeal um, candidiasis. Okay, so that's a yeast infection, and that's usually if you look at your tongue can tell you a lot about your health. And so this is because your immune cells aren't keeping in check the yeast that is found in your tongue. Okay. You can develop fever and diarrhea. This needs to be longer than a month. So if you just have diarrhea and a fever for a few days, that just might mean you're sick, right? But if it lasts for a long time, okay, then it's cause for concern. So we could develop idiopathic thrombocytopenic anemia. And we'll talk more about that when we get to the blood chapter. But essentially what it is a reduction in thrombocytes. Okay, so these thrombocytes are involved in blood clotting. Okay, you develop pelvic inflammatory disease, and so that's going to be like an infection of the female reproductive organs, and then peripheral neuropathy. Peripheral neuropathy is going to be peripheral nerve damage. Remember, the periphery is everything outside of your central nervous system. So here is the idiopathic thrombocytopenia. Okay, so when you get these little red spots popping up on your skin, okay, they are generally from clotting disorder. And so what we're getting is ruptures, and then you're getting the blood leaving circulation, and then the appearance through the skin. All right, and this leads us to category C, which is really the AIDS-defining illnesses. So the other ones, category A and B, were more asymptomatic. They were beginning to show some immunodeficiency. Okay. C is going to be full-blown AIDS, and we're going to see that individuals in category C may suffer from bacterial pneumonia, so fluid accumulation in the lungs due to bacterial infections, and you need to have more than 2 bouts of pneumonia caused by bacterial infections within a 12-month period. Kaposi sarcoma. Okay, Kaposi sarcoma is going to be a cancer of the connective tissue and of the blood vessels. Okay, so normally the helper T cells would be able to keep this in check. Okay, and then when your immune system gets so compromised that you can no longer keep it in check, okay, then these cancer cells, the normal cell cycle can no longer be, so you normally take them out of your body. Okay. And when the helper T cell count goes down, you can no longer maintain this. And so this is generally at one of the late stages of AIDS. Okay. You can get yeast infections of the respiratory tract and the esophagus. So remember that in category B, it was just on the tongue surface, mucous membranes. Well, this is now going further. Cervical cancer, so you see all kinds of cancers, cervical cancer, the Kaposi sarcoma. You see lymphoma, right? So lymphoma is going to be cancer of the lymph nodes, essentially. Okay, so it's not of the lymph nodes, but it's of the cells, the lymphocytes and the lymph nodes. Toxoplasmosis, which is an infection, and so you're susceptible now towards infections. Okay. And so we can see parasitic infections lasting longer because now your immune system is compromised. Just a few others. You could get your response to herpes simplex virus is going to be extended. It's going to last longer than a month. Cytomegalovirus disease, encephalopathy, tuberculosis, and so. But you see what we're getting to here. We're getting to this increased risk for infections. It's not the HIV that's killing you. It's the development, or it's the progression of your immune system becoming less and less effective. that's resulting in all these conditions. And so you can look at table 2-6 for a comprehensive list. I'm not going to cover everything in there for category C, but there is a number of things. Generally, we see the development of this disorder associated with numerous manifestations. Okay, so how is HIV treated then? There is no cure for HIV. Okay. There was a in poor taste a joke that once was, and that the cure for AIDS is money, right? So Magic Johnson is probably one of the most famous people to get AIDS or to develop AIDS because he acquired HIV at some point, and he had a lot of money, and so he was able to manage it really well. And so they've lowered the amount of HIV in his body so that it's no longer detectable. I don't know, it's probably not gone, but it is low. So there is no cure for it though, but we use retroviral therapy, and really we use multiple retroviral therapies, right? So we use multiple retroviral drugs to prevent the incorporation of the HIV virus into our own DNA. Okay. And so the retroviral therapy, antiretroviral drugs prevent the HIV from replicating. And so we generally use these in combination, and so we like to use multiple. And so we have this approach. It's called highly active antiretroviral therapy, or HAART. Okay, and that's when you use 3 or more antiretroviral drugs, okay, to be most effective. And so if you don't maintain a regimen, it can lead to drug resistance, just like bacteria or antibiotics. And so if you don't take a full dose of antibiotics, any kind of bacteria that you leave after that alive have developed have acquired a resistance to that antibiotic, or likely have. And the same can occur here. Okay. So as the disease state progresses, you'll want to develop a treatment plan in concert with your physician, with increased testing. So this leads us to the risk factors for immune dysfunction, right? So first of all, we have chronic disease being a risk factor for immune dysfunction. Anything that is challenging your immune system. And remember that your immune system is meant to attack things and get rid of it in the short term. Okay, it's not meant to be a lifelong protective state. It is meant to be a lifelong protective state, but it can't keep on being challenged. Okay, so we have chronic disease being a factor. Corticosteroid therapy. So corticosteroids depress your immune system. Remember, corticosteroids are another name for cortisol. An analog outside of the body is corticosteroid. And these can be delivered to reduce inflammatory events, but they have the trade-off that they depress your immune system. Okay, chemotherapy. Chemotherapy oftentimes involves really toxic chemicals, and so we use chemotherapy in response to cancer. And so the use of the drugs actually kills healthy cells as well. Smoking is not a good thing. Is one thing in this course is you're going to come across is that smoking causes a lot of disorders, okay, and as a result in a lot of disease states. And we'll talk more about that. Excessive alcohol consumption and immunodeficiency. Okay. So the take home for this is, you should be living a balanced and healthy life, meaning you're getting exercise, you're eating the right foods, and you're eating them in a balanced way. Okay. So this includes proper fluid intake, well-balanced diet, exercise, not too much stress, as much as we can try to reduce that, then adequate amounts of sleep. So to summarize this presentation, you should know what immunodeficiency is now. What does immunodeficiency cause? Okay. And the example that we used in this immunodeficiency is AIDS and HIV. Okay. So you should know how HIV infects the cell, how it alters bodily functions, okay, how AIDS develops, and what are the definitions of the different categories. Okay, how does AIDS impact the body? Okay, so it is immunodeficiency state. Okay, how does it impact the body? What are the manifestations that develop at the different levels of progression? And then how is AIDS treated, right? So is there a cure? Is there not a cure, right? So these are all things that you should be familiar with at the end of this, at the end of the audio lecture. All right, so until next time.